I don't like reading in the newspapers or getting my report from the COVID team. Today we lost 400 people. Today we lost 350 people. So it's much, much better than it was, but it is not at a level low enough where we should feel we're done with it completely, because we're not.
That's a reminder from our nation's top medical expert as Americans plan more gatherings and travel for the holidays. D.C. public schools, for example, have required a negative test for students to return from Thanksgiving break. Major pediatric health groups are calling for the White House to declare a national emergency as RSV and the flu surge. So far, no declaration has been made. Doctors have also been warning of this tripledemic, which means the COVID, RSV, and flu all at once. Dr. William Schaffner of the National Foundations for Infectious Diseases says now is the time to get vaccinated.
It's a long winter. Let's get our protection down now, and that will carry us through January and February and into March. Help protect the people around you, too.
Last week, the White House started a new push to get more Americans to get those COVID boosters before the end of the year. CDC data shows more than 37 million Americans have received the latest updated bivalent booster. It is only a fraction, though, of the 267 million Americans who are eligible for the shot. Joining us now, Dr. Kristin Englund, infectious disease specialist at the Cleveland Clinic. I appreciate your being here this morning. Have we let our guard down too soon?
Well, I think that's to be seen. So we know that COVID numbers are stable right now, but we certainly are concerned as to what we're going to see after the holidays. Now that everybody has been getting together with families and traveling across the country, we may start to see an increase in COVID again, as well as influenza and unfortunately RSV in our children and our very old.
So let's talk about COVID and the booster, the bivalent booster. What's your messaging on this? What is preventing people from going and getting that shot if they've already gotten several of the shots previously?
So I don't think people understand that this new vaccine that's come out is different than the previous one. The bivalent vaccine is geared towards the BA4 and BA5 variant. And while the numbers of the BA4 and 5 are declining, it's still going to afford you some protection against this new Omicron variant. So the Omicron variant is very different than the first variant that we saw a couple of years ago. So it's important to get some protection. Some is better than none.
And people who have had COVID over the summer or in the last few months, should they wait before they get this bivalent booster?
We're recommending now that you wait probably 2 to 3 months, because having had an infection recently, you're likely to have at least a couple of months of protection. But it's still important to keep that in mind, that you do still want to get that vaccine, because getting vaccine protection on top of your natural infection protection is still very important.
How long before it's effective and how long does it last? Do we know?
Yeah, so it does take at least 2 weeks for any vaccine to really start to become effective. So you want to start planning well ahead of time. If you're planning on getting together with family members over the upcoming holidays, don't wait until the last minute to either get the bivalent COVID vaccine or, importantly, your flu vaccine. Get them now. It takes 2 weeks and they'll last at least several months, so don't wait.
So we keep hearing the word tripledemic, tridemic, COVID, RSV, the flu. What concerns you the most about these viruses as we head into the cold months?
Well, we certainly know that all of them are winter respiratory viruses. And as the weather starts to get cold, people are spending more and more time inside. And with the holidays, they're getting together with their loved ones. So we're seeing here in Cleveland a stable number of COVID infections, but we expect an increase. We're seeing a decrease in the RSV numbers, thankfully, but they're still quite high. And we're seeing a huge increase in influenza, mostly influenza A. So whether you're at risk for getting any of those, make sure that you're using some form of protection, whether it be masking or social distancing or trying to do things outdoors, but most importantly, get vaccinated against what you can.
Right, which is the flu, which is COVID. No vaccine yet for RSV.
Not yet.
Yeah, and I've had a few encounters with parents recently whose kids have come down with RSV. It's scary. It's a really high, unmanageable fever. They're not sleeping at night. They're having a lot of trouble breathing. Who is more susceptible for this virus, and what's your messaging on that if you start to notice the symptoms?
So unfortunately, it's children under the age of 5 who are at most at risk for RSV, and then are very old as well. And keeping in mind that as we gather together, we want grandparents and grandchildren to come together, but viruses can be spread in those kinds of situations as well. So certainly children who are having any kind of a really high fever, say over 103, if you notice that your child is having kind of a grunting sound when they're trying to breathe, certainly if there's any kind of discoloration in their fingers or their toes, you need to make sure you're taking your children to the emergency room at that point in time.
Should people still be wearing masks if they've got a common cold and they're heading out into public? What's your advice?
Well, I'd say it's really difficult to be able to tell the difference between a common cold and some of the early symptoms of RSV or influenza or COVID. So if you're going out into public and you have any kinds of symptoms, I think it's important for you to wear a mask and protect those around you, because you don't know what the immunologic status is of those people around you. And you certainly don't want to be passing something on to someone else.
Yeah, keep your germs to yourself. Hey, Rick Quick, the American Academy of Pediatrics Children's Hospitals want an emergency declaration to help an overwhelmed health system. Do you agree with that, and what would that do?
So I certainly think it's important to listen to our people who are on the ground, the physicians who are in these, especially these children's hospitals that are getting overcrowded. An emergency declaration would certainly be able to help them get more money to be able to hire the important staff that's needed and be prepared for all of the potential incoming children. We want to make sure we're protecting those kids as best we can and take the best care of them.
All right, important precautionary steps we all need to be taking. Our common goal, staying well through the holidays. Dr. Kristin Englund, infectious disease specialist at the Cleveland Clinic. Thank you for your time this morning. Good to see you. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.